You're on with your health, and in what many see as another historic breakthrough, the World Health Organization has recommended the use of the first ever antiretroviral vaginal ring as an additional HIV prevention choice for women. Our health and science editor, Dr. Mercy Korir, explains why this is a game changer in containing the decades-long pandemic.
Women at high risk of contracting HIV infection now have another preventive alternative in their pockets, the first ever vaginal HIV prevention product, a dapivirine ring. The ring, which must be worn inside the female organ for 28 days before replacement with another ring, is made of silicone and is easy to bend and insert.
This is actually a product that they can make decisions around by themselves, utilize it, without really having to, tell a partner or having to tell anybody about it.
Studies demonstrated an HIV reduction of 35% in women using this ring as a complementary prevention approach, in addition to other safe practices when oral pre-exposure prophylaxis PrEP is not used, cannot be used, or is not available. The ring, indicated for women over the age of 18, is still under further investigations to determine safety and efficacy in pregnant and breastfeeding mothers and on resistance testing in women who become HIV positive despite using it.
Considering for us as a country, we are reporting 275 new infections amongst girls every week.
The International Partnership for Microbicides, IPM, and Q-Pharma have been working together since 2010 to develop the manufacturing process for this ring, but it will be several months and even years before Kenya has this ring available for women.
They have done a submission to the South African and will soon be doing a submission to the Kenya Pharmacy and Poisons Board. So it's until we have that approval that we can then say Kenya is actually ready to bring in the ring.
This ring comes just days after the U.S. Food and Drug Administration approved the first monthly HIV 2-drug combination injection that can replace the daily pills currently in use to control the virus. Kenya has 1.3 million people living with HIV, and these global milestones in the treatment for HIV will take the country a step closer to eradicating the HIV pandemic. Dr. Mercy Korir, KTN News, in Nairobi.
And with me here in studio is Dr. Peter Cherutit, public health expert, who's going to shed more light on these new drugs. There's the jab that is new, and of course that vaginal medication that has been deemed to be 35% more efficient in preventing infections. What do you make of that, and why, as they have asked, is this a game changer?
Thank you very much, Trix. Indeed, this is a game changer. In fact, over the last few months, there have been 3 pieces of good news.
Yes.
One is what Mercy has just talked about, the vaginal ring, in which amongst women who are HIV negative, they can use a ring to protect themselves from getting HIV. The second piece of good news is an injection, a monthly injection, that is also for prevention. So, and that is for everybody else who is HIV negative. They can also have that monthly injection of a drug called cabotegravir.
So the jab would be for people without HIV or with HIV?
Yes, without HIV.
Okay.
And they have it monthly, and it will also prevent them from getting HIV. The third piece of good news is, again now, an injection, actually a combination of 2 injections, which is now, will be used for people who are HIV infected, and it will now replace the need to actually take pills on a daily basis.
But when you talk about the 2 different injections, you're talking about 2 different drugs put into one, and therefore they're having a drug that can be administered intravenously. Now, let's break it down. This is very good for women. Let's talk about the vulnerability of women when it comes to HIV, and why then this is very good news. What are the infection rates what have you encountered in terms of numbers in your line of work, and why this is very important for the women in our communities?
Yes, thank you. Women in our communities, particularly in sub-Saharan Africa, are at a very high risk of HIV, and they're very vulnerable to HIV. For one, we know that for occupations like sex work that puts a lot of people at risk, it's mainly women actually who are involved in these occupations.
Yes.
And there are also other biological reasons, there are social reasons why women tend to be at a high risk of HIV. In fact, in Kenya and in most of the sub-Saharan Africa, we find that the prevalence of HIV amongst women can be sometimes 1.5 to 2 times compared to that of men. And so really, in our setting, more than probably anywhere else, women require more options. Women require a greater availability and a greater mix of options that they can use to prevent themselves from HIV.
Right. Let's talk about those social reasons you've mentioned. Why are our communities particularly unique, and why do they make women more vulnerable to HIV infections?
Yes, from a social perspective, you know, in we are a very highly, patriarchal society. Our gender norms are such that women do not really have both the social and the negotiating power, and also the economic power compared to men. And so you find that women, particularly girls, will probably be taken advantage of. Women at a very high risk in our setting of getting raped. And also we know that because of the socioeconomic opportunities that are few amongst women, then they're also most likely to engage in sex work, and particularly at a very young age. So we find in some parts of this country, even girls as young as 13, 14 years of age are already engaged in sex work. And of course, at that very age also, their body is not fully developed, and their body and their organs are not able to protect them from HIV.
So, Mr. Cheritich, when you talk about this, then of course the fact that one can personally administer this and have it for 28 days, that is a good thing, because it sort of gives them the power to actually protect themselves. I would imagine that would be something that is quite positive in a society that frowns upon perhaps going to a clinic, or perhaps, you know, being very upfront about seeking solutions to this problem. Let's also talk about that jab. The one you've talked about, I didn't know there was one that could be administered to people who are negative as a preventative measure. Explain more about this, and how different is it from the PrEPs that we have been hearing about over the past few years?
Yes, this new injection is also a PrEP. As you may know, that in this country and globally, it is now recommended that people who are at high risk of HIV, including sex workers, men who have sex with men, or other people who are engaged in activities that put them at a very high risk of HIV infection, would need to take a pill every single day to be able to protect them against HIV. Now, this injection is basically replacing the pill, so that instead of you taking the pill every day to protect yourself from getting HIV, you actually replace it now with an injection.
Okay. Yeah. Right. Now, when it comes to who would get it, are there any restrictions in terms of age, or perhaps viral? No, viral is with the third one, but in this one, in this particular one, who is eligible to go for this option?
Yes, for this one, for this option for prevention, we'll talk about the treatment aspect later, but for this option for prevention, the goal is just to replace the oral version of it. And in the guidelines from WHO, and they've been adopted also locally, there are certain categories of people that are considered eligible. One, as I mentioned before, are sex workers, men who have sex with men. We also have couples whom we call in discordant relationship. So if you have a couple, one is HIV infected and the other one is negative, the partner who is HIV negative is required to take PrEP, or to take the pill up and until the HIV infected partner's viral load is well controlled. So it's also to protect the negative partner in a relationship from getting HIV. So that's part of the use. And of course, many other scenarios. We found cases also where adolescents in certain settings may actually need to require, yes, and may actually require because they are at high risk. And depending again on circumstances, you can still be able to provide this also to the general population. So if somebody feels that sufficiently at a high risk because they have multiple partners, for example, then they would be required to take this. At the moment, though, you just have to you can't go to a chemist and purchase PrEP. You have to be registered in a clinic or in, at least in a setting where you can be provided with HIV testing, because this drug, you can only take it if you're HIV negative, and you have to be confirmed to be HIV negative.
After testing. And that brings me to another issue, just like the vaccines we've been talking about in the first segment of this, of Your Health. Another question is availability, because while we might have the need with the discordant couples or the people who are more vulnerable, commercial sex workers, people engaging in homosexual activities, perhaps there's a question of how can one get access to this drug, the intravenous one particularly. Is it as easy as one would hope?
Trixie, thank you for that question. The injectable one is not yet available locally.
Yeah.
But I was saying it is a piece of good news, because it's something that I know we've received its approval only recently. WHO is looking at it and see whether it would recommend it to countries. So it certainly will take time before it comes and becomes available in sub-Saharan Africa. But that said, at the time that it will be made available, it will be again made available through the usual channels that the oral PrEP is using. Now, oral PrEP in this country is available in select clinics. We have, government facilities that are already providing treatment for people living with HIV. In these facilities, you also are able to get PrEP, and also several other NGOs that are in the community. So we have community-based NGOs that have particular clinics that are able to provide PrEP.
Yeah, and also the cost. Could you speak to that? Would it be free?
The cost, yes, the cost at the moment, the oral PrEP, the one that is taken by mouth, is available free of charge to the client.
Yeah.
Because of an international partnership involving the US government, the Global Fund, and also governments in Africa, and particularly in Kenya. That is available free of charge. Now, we don't know when the injectable comes, what the dynamics will be, what the discussions will be at that time, but the anticipation, and this is what we anticipate, is that it will also be free of charge to the patient or to the client. Of course, somebody has to pay for it eventually.
Yeah, but hopefully not the people who are looking for the help directly. Now let's talk about the HIV positive people, and of course how the jab is a good thing for them.
Yes, we are
those
excited.
Who are undergoing treatment.
Exactly. So so for those who have already been tested, they're HIV negative, infected, and they are already on treatment. What is happening now is that patients who are HIV infected, as soon as one is diagnosed, they are put on antiretrovirals, which is, at the moment, the way it works is that it's a combination of 3 drugs, 3 antiretrovirals. Now, massively, that is now available as one single pill. So it's one single pill every day, but with 3 drugs. We've come from far, of course, from a time when people would take, more than 10, 15, even 18 drugs in a single day. And that has been condensed into one single pill per day. Now, this injection also improves on that one single pill per day, so that instead of taking a pill every single day for 30 days, you just need a set of injections once per month. So this is definitely a relief to patients because...
How so?
Taking a pill every day, is still a big of a struggle. People forget to take their pills. People sometimes don't have the food to actually take the pills with, And so there are a lot of challenges.
Please go deeper into that element of having to eat, because poverty is a big problem in certain communities and certain groups. So when you're taking it from a daily pill, why does the pill require you to be eating constantly and in a healthy way? And perhaps how will this change for such people who cannot even afford to have 3 square meals a day?
Yeah, so one is that, you know, some of these, actually, these HIV medications require to be taken with food, because it also enables it to be absorbed better in the body, in the system. But
and if you don't, then what happens to you?
Yes, if you don't, then you find that the absorption doesn't take place very well. The concentrations of the drug in the blood does not reach a good level, or the level that is sufficient to control the virus. So that is important. But also HIV-infected people, as we know, the HIV virus itself has a way of destroying the body and weakening the body. So the body requires more nutrients than somebody who is not HIV infected. So people really require to have food. And of course also water, because, you know, these, you know, drugs they have to be flushed
out of your system.
Out of the system through the kidneys. So you need to take plenty of water as you take your medication. But with the ones, you know, monthly injectable pill, I think the exigencies, or rather the requirements that you really have to have food. Of course, it's important to have food, but tying it with food is something that I think will be will relieve a burden to a lot of people.
Okay, and also there's the element of forgetting. What happens when one forgets or is faced with the burden of going about their business, trying to make money, you know, jobs, and at the same time have to remember to take a pill? Then, I mean, if this is eliminated, this is a good thing, right?
Right, absolutely. And just as it happens with everybody, you know, even when you go to a doctor and you have maybe just a simple, even if it's malaria and you're told to take a 3-course or a 5-day course of maybe antibiotics, it's difficult. A lot of people can't even finish a 5-day course of antibiotics. So you can imagine a lifelong commitment to take a pill or pills every single day. It's not easy.
Yeah, it's not easy. And what happens then when you forget? Because I would like to bring out the importance of that once-a-month injection or jab.
So when you forget your medication, because it has to be taken every single day so that the concentration of the drugs are high enough to be able to keep the virus at bay. But once you forget to take your medications, or you take your medications in a manner that's irregular, you take today, you forget tomorrow, maybe also you probably didn't pick you didn't go to the clinic on time, and so you run out for about 3 days, so 3-5 days. Then what happens is that the virus rebounds. The virus gets an opportunity to come back and circulate again in the blood, and that's not good for your health, because it again begins to destroy the immune system.
Okay, and are there any special consideration as to who would be getting this particular jab?
For now, based on the research that was done, this is approved for adults. But we do believe that even as we're rolling out to adults, that there will be research that will be done in children, so that this can be available to children. We're still waiting for guidance from WHO, whether this can be used also for pregnant women. At the moment, it appears that pregnant women may not be able to use this. But WHO will be able to look at many other factors and be able to give us a guidance as to which groups can use them and which groups may not use them.
All right, but all in all, it is a game changer, as they say.
Absolutely.
Yeah.
Absolutely.
Now, you've pointed out the journey that it has taken when it comes to HIV medication and research. We've gone from the 18 pills a day you've talked about to 3, then to 1, and now we're talking about an injection. What more could be done in the treatment of HIV to ensure that it's easier for those who are receiving it and even perhaps more efficient?
Yes, yeah, we celebrate those successes. We know that there are more to go. If you've been able to have a monthly jab, then it's also possible, theoretically, to have an yearly jab. We're still waiting on the vaccine.
A yearly jab?
The vaccine is something that we're looking for. And at the moment, I'm part of a group of experts internationally that are beginning to design a potential HIV cure.
Okay.
Because we know probably in the next decade or two, we would have sufficient technology to be able to cure HIV. So, but we have to think through what would that cure look like in terms of a patient. Will it be like, you know, would you require maybe to already be on antiretrovirals and very well suppressed, and then you take a cocktail of maybe antibodies or things like that? So there's a group of people that is working on that, and so that is really the future. It's possible.
And as far as specializing or trying to get a solution once and for all for this, there is a lot of conspiracy theories that is around the treatment and, of course, that journey towards a cure. Could you tell us what your reaction is to those that say you've had, even some presidents, leaders, questioning why it took so short a time to find a vaccine, even though it's not perfect for COVID-19, and yet it has taken us decades, and you've even pointed out right now that it would take perhaps 2 more decades to find a cure. What do you say to that? And perhaps could you draw the comparisons and explain the challenges towards finding a cure?
Trixie, it's a good question. But yes, COVID-19 and HIV, both are viruses, indeed. But they are very different viruses. You know, COVID basically goes, you breathe in, and rather you have contacts, and it goes into your respiratory system. And you're able to just stays generally within the respiratory system. Now, HIV is more devious. It tends to be more sly in the sense that, yes, once it goes into your system, it hides in some specific parts of the body that is very difficult. The tools that we have, whether they're drugs, they're antibodies, or even a vaccine, it becomes very difficult to actually be able to access them.
Right.
So you have to trick them. We have to trick HIV from its hiding places, so that it now comes into an open area for you now to apply your vaccines or any other technology. So it's just that it's a different virus. It works with the body differently.
That's the long and short of it.
Yes.
Okay. Now, as being privy to the challenges that people looking for treatment are facing, what would be your last and concluding statement, a message to people out there who are hoping for a cure, who are hoping that this jab will be available to them? What would you say to them as they continue fighting that fight against HIV and living positively?
Yes, I would say to every HIV-infected person out there and their caregivers that we are at a very important point in history, and we've come from far. At the moment, the drugs that are available for taking daily are the safest that we have, and so we have to make sure that we maximize those. We've seen over time that the safety of antiretrovirals has actually increased to a point now where they have the minimal side effects, and that if somebody is able to take their ARVs on every single day, they're actually able to live their life normally. And in fact, there's a life expectancy that is normal. So we do hope only that these gains can be consolidated with the monthly jab. But the most important thing is that even if it comes to the jab, the most important thing is to be religious with appointment with your doctor to make sure that you appear at clinic every single month on the same day of the month. With that, there is an assurance that life will be normal.
There is hope, basically. And that has been Dr. Peter Cherutich, a public health expert, bringing us perspective to the question on HIV treatment and how better it can be, and how many ways it can be made better. Thank you so much. We're going to take a short break. On the other side, we have both local and international news awaiting you. Stay tuned to Morning Express.